would be an egg donor and or a sperm donor? These are generally speaking young, college-aged people. Let's try and separate them. Egg donors, young college-aged women, usually between the age of 20 and 28, and they're not really interested in having a child of their own at this time. They're interested in helping people because either they know somebody who's had infertility or they've read about it. They do get paid, so many of them are interested in earning a little bit of extra money, and they're healthy and they're keen to do something very positive to help other people. As far as sperm donors are concerned, sperm banks would advertise for people to come in and deposit some sperm, and it's always done on an anonymous basis. The gametes that they deposit, either the eggs or the sperm, are ascribed to people, and it's done anonymously, so they wouldn't know who purchased their eggs or the sperm. Who would become a gestational carrier? This is a good question. These are generally speaking women who have children of their own. They're healthy. They're not interested in having more children of their own. They learn about infertility either by reading about it, seeing programs on television, talking to other people about it, and then they project inwards and they see what their life would be like without their own children, and they can't imagine it. So they project and see how it must be difficult for people who have infertility, and they realize that they could help somebody, and they genuinely enter the program wanting to help people. And when they learn about it and they go through it, they get a tremendous reward for themselves by helping people. So it's not uncommon for them to want to become gestational surrogate on multiple occasions for multiple couples, because they really do get a lot out of it. And these are very generous people, generous of spirit. New York Fertility Services help same-sex couples, both same-sex male, same-sex female. On the male side, it would be necessary to get an egg donor and a gestational carrier. And then they use sperm from either or sometimes both of the partners in the relationship. And we've had quite a number of cases where we've generated embryos using sperm from each partner, and the transfer has involved embryos from each partner, or only from one partner and freezing the embryos of the other. They tell us what they want. We tell them the options. They tell us how to proceed. On the female side, you can either get donor sperm and inseminate one of the women, or, as we've done a number of times because they really seem to like this approach, get eggs from one of the partners, harvest them, inseminate them with sperm, and transfer those embryos into the other partner. And for the second child, they want the opposite arrangement. So it's a way for everybody to feel included, and we're here at New York Fertility Services to give them options and help them make the choice that works best for their family. As far as single women are concerned, this has been a request for quite a number of years. Usually women who've pursued their career and then they reach a little older, late 30s say, and they realize, wow, they've been waiting so long and their perfect circumstance has not happened yet. So they present themselves and they wish to become a single mother, and usually we get sperm from a sperm bank and inseminate them around the time of ovulation. That's single women. Recently, we've been getting requests increasingly from single men. And when it first started to occur, it was unusual in the sense that we hadn't experienced this before. But when one sits back and thinks about it, why should it be any different for a single man to want to become a father if he hasn't found his perfect circumstance? Why is it any different than it should be for a single woman? So this is the new world that we find ourselves in, where people are pursuing their dreams, and we welcome this so long as they have the necessary support systems in place. That's up to them to evaluate, and our patients do and have evaluated this, and they realize that this is what they want to do, become a single parent. We encourage it, we welcome their involvement in the process, and they become very excellent and happy parents, and we are happy to have been able to help them achieve their dreams of parenthood.